Welcome to the Axis Pain Management Education Series. My name is David Brentnell. I'm a physiotherapist from Brisbane, Australia. If you have persistent pain, you have probably asked many questions which have confused you about your condition and your recovery. I'm often asked, why aren't I healing properly? Why do I keep injuring myself? The scans are clear, so where's the pain? They've told me it's in my head, and I'm worried I will never get better. People report that even their thoughts are affected. I get back pain from thinking about lifting something heavy, and when I'm stressed, my neck pain gets worse. These are often difficult questions to answer in short medical or physiotherapy consultations, but luckily our understanding of pain, and particularly persistent or chronic pain, has expanded significantly. This series has 4 modules, and we've collected the current evidence to answer these common questions to help you better understand and manage your pain. These 4 modules include Module 1, Funny Things About Pain. In this module, we will discuss why some people experience different levels of pain, which may not necessarily be related to the severity of their injury. Module 2, the nervous system, explains how nerves have a very important role in your pain. Module 3, How Pain Affects You, discusses how stress and emotions can influence your pain. And Module 4, Management of Your Pain, we will talk about the various tools you can use to manage your pain more effectively for the future. Now I'd like to introduce Rosemary Grant, who is a musculoskeletal and APA occupational health physiotherapist at Axis Physiotherapy, Brisbane City.
My name is Rosemary Grant and welcome to Module 1 of the Axis Pain Management Education Series. In this module, we'll be giving you an explanation about why we get pain and the reasons that pain can sometimes be very beneficial but a persistent problem at other times. We will also explain the various stages of pain following an injury and discuss the chronic pain cycle and the problems that can arise when pain lasts for a long time. At the end of this module, you will understand some of the problems that can occur with chronic pain, and this information will help you to determine how exactly your pain is affecting you. This information will then form the basis of the remainder of the educational series. With me is Matthew Forster. Matthew is a physiotherapist who specialises in chronic pain management. Matt, if pain is such an unpleasant experience, why do we get it?
Yes, pain is unpleasant, but it's actually a very vital and necessary part of life. Normally, pain functions to alert you to an injury or a harmful situation. It makes you conscious of an injury or a potential harm, so you can remove yourself from danger or to do something to allow the injury to heal. In this way, pain is very beneficial. If you did not have pain, you could probably keep injuring yourself, as you would not be aware of an injury. Pain is actually a very great motivator, because when you have pain, it motivates you to change your behaviour in an attempt to do something to reduce your pain. Pain can motivate you to behave, move and think differently. This is great when you have pain due to, say, putting your hand on something hot, but also not so great with longer term injuries, because pain can alter your behaviour, movement and thinking in negative ways.
Matt, patients have said to me that when they have pain, they can't think straight and they can't do their normal activities.
Yeah, that's right, Rosemary. People often say that they can't sit for too long, or they have trouble getting back to work, or they don't go out as much. People have also told me that they can't concentrate, and their mood changes, and their sleep is even disturbed. These are common examples of how pain can affect you in a negative way.
We have outlined that pain can make you behave, move and think differently. Take a moment to think about these 3 points. Can you think about how your pain has made you behave, move or think differently? If so, you may be able to manage your pain more effectively by using the tools we will give you in Module 4.
Current knowledge about pain recognises that pain is a multidimensional problem. When assessing and managing pain, we need to take into account not just the injured part of your body, but also the entire pain system. The pain system includes firstly the injured part of your body, but also your nerves, which act as your alarms or your danger recognition system, and also the brain, which analyses these danger signals, makes us conscious of the pain, and produces a response to pain. We will be asking you a few questions during the educational series to test your knowledge. Let's start with this question. What parts of the body do we need to consider when managing chronic pain? A, the injured body part, B, the nerves, C, the brain, or D, all of the above? The answer is D, all of the above. When managing chronic pain, we need to consider what is happening in the entire pain system. This includes the site of the initial injury, the nerves which relay the danger and alarm signals, and the brain which interprets the danger signals, creates pain sensation, and decides on a response to the pain. We know that the intensity of pain that you feel does not match up directly with the severity of your injury. You may remember a time when you sustained an injury, but maybe not felt pain at the time. Also, the intensity of pain that you have cannot be seen on an X-ray, a CT scan, or an MRI scan. For this reason, sometimes it's hard for people to understand how much pain you may have due to an injury. And the reason for this is because pain is produced not just by the injured part of your body, but also the entire pain system. Research has shown that people can have a disc bulge on an X-ray or a degenerative change on an X-ray and have no pain. On the flip side of this is people can have a normal X-ray and be in quite severe pain. This again shows that pain and an injury aren't a perfect match. When there is chronic pain, there can be pain anywhere along the pain system. There are many common examples of how pain and injury are not a perfect match. You may be able to remember a time when you're watching a football game and you saw the player sustain a bad injury, such as a broken jaw, but was able to push the trainer away and keep playing. Also, there are very classic stories of wounded soldiers who sustained quite severe injuries, such as a gunshot wound, but weren't aware of it at the time and were able to keep going. At times, your body, for many different reasons, can either increase or decrease the amount of pain that you experience. These factors can include the situation or the environment that you are in, your level of motivation, the people around you, but also certain chemicals such as adrenaline and endorphins, which are your body's natural painkillers. These factors, as I said, can increase or decrease the amount of pain that you feel.
So far, we have discussed why we get pain and how pain is not always a perfect match to the severity of an injury. We will now move on to talk about pain in specific time frames. How long you have pain for is extremely important in determining what the causes of the pain are and how we need to go about managing the problem. We describe pain as acute or chronic, depending on how long the pain has lasted. We will now talk about each of these stages, what they mean, and what needs to be done at each stage. Acute pain occurs immediately after a new injury and is defined as pain that lasts up to 6 weeks following an injury. Acute pain is produced due to a new injury and means that new tissue damage has occurred. In other words, it is a sign that previously healthy tissue has been injured. Remembering our alarm system, acute pain is very vital information to motivate us to change our behaviour to avoid further injury and to allow healing to occur. It motivates us to protect the injury and to be conscious of it so we do not hurt it again. For example, when you sprain your ankle, the pain and swelling motivates you to reduce the amount that you move and walk on your ankle. The acute pain is very helpful to allow our injuries to get better.
Treatment of acute pain is very specific and targeted at the injured part of the body. Treatment may include analgesia or anti-inflammatory medication, supportive devices such as bandages or braces, hands-on treatment such as massage or physiotherapy mobilisation, as well as the use of ice packs or hot packs. We call this type of treatment passive. Often there is a small amount of specific exercise which is also beneficial in acute pain. Again, the exercise is usually specific to the injured body part. As acute pain is defined as lasting up to 6 weeks, this type of treatment is also beneficial during the acute phase. Most soft tissue injuries heal between 6 to 12 weeks after the injury. During this time, all going well, you should expect the level of pain to gradually subside as the injury heals. All injuries have a defined healing time. By 12 weeks, the healing process for most soft tissue injuries will have occurred. The healed injury may have a bit of scar tissue or may not be as strong as it was originally. If the pain continues after this time, there may be other complications or causes of the pain besides just the extent of the physical injury. Remember that the pain and the severity of injury are not a perfect match. The treatment of pain in this phase needs to change from passive treatment to a more active form of treatment. Let's have another question. How long do most soft tissue injuries take to heal? A. 2 days. B. 6 to 12 weeks. C. 9 to 12 months. Or D. 5 years. The correct answer is B. 6 to 12 weeks. Soft tissue injuries generally heal in 6 to 12 weeks by forming a scar tissue. The scar tissue may not be as strong or flexible as the original tissue and now needs exercise to restore the strength and flexibility of the tissue.
We will now move on to discuss how chronic pain is different from acute pain. Chronic pain is defined as pain which lasts for longer than 3 months since the initial injury. It is also defined as pain which lasts longer than the normal healing time for a given injury. Because the healing process has usually finished, the injury should need less protecting. There should be less reason for your alarm systems to alert you to the initial injury. However, in chronic pain, for some reason, your body's alarm system keeps sending information from your initial injury and your pain system keeps generating pain. The purpose of pain at this stage is no longer protective or beneficial for any specific reason. The pain is debilitating and prevents us from returning to normal activity, but it is difficult to see how it can be serving any useful purpose. Chronic pain is a problem in its own right, rather than a symptom of the initial injury. In Module 2, we will discuss in depth the problems that occur in the pain system. The problem of chronic pain can be best described as a cycle. Look at the pain cycle. When you have pain, it is normal to want to reduce your movement to prevent pain. Often, people develop a certain fear of movement because they are worried about hurting themselves again. Over time, this fear of movement can persist and lead to generalised deconditioning. Chronic pain can also be associated with altered mood or depression, anxiety, and increased stress levels. This can all lead to problems such as not being able to participate in hobbies or normal activities, or not being able to work. This can be referred to as a functional decline. All of this can lead to further pain. It is apparent that the problem of chronic pain affects not only the initial injury, but many other areas of your life. Considering the extent of problems which may develop, the management of chronic pain therefore needs to be very different to the management of acute pain. Whereas acute treatment is described as passive, chronic pain treatment needs to be active. This means that treatment is focused on breaking the chronic pain cycle. This may include becoming more knowledgeable about the initial injury and how the pain system works, working on ways to reduce fears and anxieties associated with movement, performing exercise for not just the original injury, but also for your whole body in order to correct the deconditioning that occurs. The exercise you need to perform needs to become more functional in order to simulate the type of work and activity you normally do. Research has proven that relying on passive type of treatment is unlikely to be beneficial in the chronic stage. As a number of complications can occur in chronic pain, often you will need a number of health professionals working together to best manage your problem. This may include GPs, specialists, physiotherapists, occupational therapists, or psychologists. This is called the multidisciplinary team, which work together to manage your specific problem areas. Let's try another question. What do you need to do to manage chronic pain? A. Learn about the causes of ongoing pain. B. Reduce fears and anxieties about movement. C. Perform exercise aimed at the whole body. Or D. All of the above. The answer is D. All of the above. Effective management of chronic pain is different to managing the acute pain of a new injury. Chronic pain management requires becoming educated about the causes of pain, reducing fears and anxieties about movement, and beginning a gradual exercise program aimed at the entire body. We will discuss this further in Module 4.
As we have discussed, there is an important difference between acute and chronic pain. New research in the last 10 years have given us a much better understanding of the problems that occur in chronic pain. The good news is that we know much more about why people have persisting pain, which can last longer than the normal healing time for an injury. We will now share with you this knowledge and use this to get you back on track.